Hello, everyone. Great to see you all here. I noticed that we're still waiting for some folk who have registered, so we might give people maybe 30 seconds before we get started. Sorry for joining a little bit late, but yeah, we appreciate your patience, and yeah, I hope that you're excited as much as we are to talk to you about AFSA's collaboration role in shaping the future of animal-free testing in the EU chemical regulation space. I think as we're kind of waiting for people to drip and drab in, I can start by perhaps introducing myself and and the other chair. So my name is Jay Ingram. I'm the Managing Director for Chemicals in the regulatory science space for Humane World for Animals. And I am joined as a chair by Nicolas Fabre, head of the Chemical and Cosmetic Advocacy Expert Group at L'Oréal. If you want to say hi, Nicolas.
Hi. Welcome.
Yes, welcome everybody. We want to welcome you to today's webinar, and I want to remind folks that this is actually the second in a series of webinars that we are running. We had the first webinar on the 18th of June, which focused on really giving an introduction on AFSA's regulatory transformation strategy. What we want to do with this webinar and further ones in this series is to really dial into what is happening in the local region or country. So today we're talking about the EU, specifically how AFSA's actions and our projects and our tools that we're developing can interact with the EU regulatory landscape and the evolution that's happening within the EU. We have on screen here a QR code and a link to the video from the previous webinar. If we are talking about something that maybe you don't quite fully understand the details of, I would encourage you to watch that webinar, as this is where we might have introduced some of these concepts. But in any case, we have a very accessible webinar for you today. And just to go over a few housekeeping things before I hand over to Nicolas to introduce our speakers. I just wanted to tell everybody that this webinar will be recorded and made available as the previous one was. The previous one and this one will be available on afsacollaboration.org. Our slides will not be made available online at the moment. If you do want a copy of the slides, we're happy to share them, but please reach out to us individually if you do want a copy of the slides. Also, the chat may not be fully monitored. So if you have any questions, and just to help us keep track of all of the questions that you might have, please use the Q&A function that you see at the top of your screen. And we will try and leave 10 minutes for Q&A at the end of the webinar, but we have a huge amount to get through. So I'm going to stop talking and I'm going to hand over to Nicolas, who will introduce today's speakers.
Thank you very much, Jay. And I would like to introduce, let's say, our today's speakers. So first, Georgia Paloka. She holds a PhD in vitro toxicology and is Senior Program Director in Regulatory Science at Humane World for Animals, where she contributes to initiatives advancing non-animal approaches to chemical safety assessment. In her position, she's also playing a key role in scientific projects within the Animal-Free Safety Assessment Collaboration, AFSA, focusing on developing tools to build confidence and trust and accelerate the transition to human-relevant animal-free safety assessment strategies. And our second speaker for today is Martijn van Veldhoven. He is a neurotoxicologist with a chemical background. He has more than 20 years of experience in various industry sectors, such as the biocide, cosmetics, detergent, and specialty chemicals. He is specialized in developing and implementing chemical management strategy, technical advocacy management, safety risk assessment, occupational toxicology, regulatory product compliance, product safety, sustainability, and innovation support. With his company, Veltox Strategy Consultancy, he is currently supporting Humane World for Animals and the Human Animal-Free Safety Assessment Collaboration. He has been leading the project on difficult, impossible, and meaningless testing and facilitates the AFSA Global Science Committee meetings. And with this short description of our two speakers for today, I would like to leave the floor to Georgia, followed by Martin. Georgia, over to you.
Perfect. Thank you very much, Nicholas and Jay, for the introduction. And indeed, we have a very brief introduction to AFSA in case any of you were not there at the last webinar, but then we'll dive into the topic for today. So AFSA stands for Animal Feed Safety Assessment Collaboration. Is a partnership across more sector organization, including experts from regulatory agency, from industry, from animal welfare NGO, philanthropic leaders, and we work together to advance the acceptance and use of animal-free safety science globally. We have at the moment two work streams. One is focusing on medicines, and one is including chemical and consumer products. That is the focus of today's webinar as well. Oops. Our work stream is really building on our regulatory transformation strategy that we have presented at the last webinar. The aim is to build bridges and also capacity and trust and alignment among stakeholders globally. What we do is to leverage and benefit from existing global roadmaps, strategy, replacement commitments, and we do that, so we support that as an influencing way to increase implementation. AFSA is working as both the global and regional perspective. We have at the core the Global Science Committee that is really made of experts from different parts of the world and with different sectors that provide guidance and also the scientific input to supporting the collaboration. We have then the Executive Committee, but then we have different local teams. These are really the ones that are in the different geographies and help to tailor the project to the needs of the specific geographies and really identify which are the most relevant needs that we need to address and tackle. What we do is it's really central. It's the part about trust building and confidence building. So this is central part of the work that the collaboration does. And one of the most relevant tools that, for instance, has been produced in the last year is the AFSA Masterclass. This is a free online accessible masterclass in animal-free safety assessment that has been a joint collaboration, very different, and many collaborators of the AFSA collaboration is made of different modules and is really practical to be used. So please, if you are interested, just try and register because it's a very relevant tool. So as Jay has mentioned at the beginning, this is a second appointment of this webinar series. We had at the beginning the overview on the global regulatory transformation strategy, and today we will see how this looks like in the European Union. If we look at the numbers in terms of animal use for regulatory purposes, and we specifically look for regulatory testing, according to the latest statistics provided by the European Commission, we are still talking about more than 1 million animals that is used. A large portion is for medicinal product and for veterinary medicinal product, and that's why it's really relevant that we have a work stream really focusing on tackling on this issue. But also a relevant part is still for industrial chemicals. This is a particular area where in general, in many different areas, we see a decline and a positive trend into the reduction of the numbers of animals. In particular for testing of industrial chemicals, this is not the case. So it's really an area where it's important to act and do something. And this is indeed was one of the focus on this initiative, the European Citizen Initiative, Safe Cruelty-Free Cosmetics, Commit to a Europe Without Animal Testing. This has been an initiative that pulled together on more than 1.2 million signature in 2022, asking for a commission to take a role into accelerating the reduction of animal testing for for chemical risk assessment. And in this response, the Commission did commit to establish a roadmap to phase out animal testing. And this document has been very recently adopted in the 1st of June 2026. And it's really a great milestone to have this document published, because it's really providing many information and action that should be done to advance for the reduction and phasing out animal testing. So in the next slide, I will just give some more description of the roadmap. The goal is really to establish a new regulatory framework that is fully based on animal-free risk assessment. Nevertheless, this is the long-term goal, and the document also identify different action that will replace, but in some cases still reduce and refine animal testing, both for human health and environmental safety assessment. So the action that the document provides are divided in short term, where, for instance, they talk about endpoint, where there is already availability of mature non-animal methods that could be used today, or other very important action that could be done very quickly. Then there are action for medium term, for instance, the prioritization of methods for further development. And finally, the long term, where there are also discussion about new frameworks and long-term change. So just to give some example, for instance, for the short term, very relevant a major use of computational models for acute oral toxicity, or clarification or regulatory requirement for fish testing and weavings. And but we also, as I mentioned, is not only about endpoint specific, but also in general of structuring and framework. So for instance, a promotion of harmonization and global alignment, the implementation of a platform for facilitating communication and discussion between registrants and regulatory bodies. And also, as the aim is to indeed achieve assessment framework, how to characterize protection, how to ensure that we have enough confidence for its use. What is also very important and relevant in this document, that has been identified the need for organizational structure. So the roadmap will have its own roadmap steering team, and this will closely collaborate with the regulatory agency collaborative structures. So from the three agencies, EMA, ECHA, and AFSA. And this is quite important that also stakeholders will be part of some of this platform and can support the implementation. Because indeed, the roadmap, while this is really a great achievement, we will see the impact really depend on the real implementation of the action identified, because there are still the need to add some clarity on timelines, on milestones, and accountability, and also funding that is not yet fully be provided in some cases. One important aspect that is also a challenge is that the roadmap tackles many different legislation. We are talking about 15, from industrial chemicals, pesticides, biocides, and pharmaceuticals. So we will need to give some indication how to improve such legislation to allow more structural implementation of non-animal methods, and indeed drive the phasing out of animal testing. If we look at industrial chemicals, one of the most relevant regulation is REACH. This regulation aims to ensure high level of protection from human health and environment from industrial chemicals, but it's also in its objective to enhance competitiveness and innovation, and to promote alternative methods. So if we ask the question if, for instance, REACH has already enough information and provision to drive replaceable animal testing, indeed there are some enablers of implementation already in the legal text today. So for instance, in some specific articles, Article 1 in the objective, Article 13, and more specifically in Article 25, that is very important because define the last resort requirement. So avoiding animal testing whenever is possible, and there is an alternative that can be used. What is also structurally relevant in REACH is there is an ad hoc Annex 11, that include adaptation. So strategies to avoid to replace the testing that are listed in the standard information requirement. So the Annex 11 foresees 3 different scenarios where testing is not scientifically necessary. This is the case, for instance, where there are non-animal approaches can provide equivalent or even better information for the specific information requirement. We have the scenario where testing is technically not possible, so doing that will bring to meaningless results. And we have the third scenario where the relevance, with the presence of relevant exposure data can really tailor the testing strategy in a more scientific manner. But then if we ask the question if this is enough and the last resort requirement is fully enforced in REACH, unfortunately, the answer is no. So the recent AFSA analysis in 2024 has been published that identified a recurring issue that don't allow, where the last resort was not fully enforced, looking at real life experiences of use in REACH. And what the outcome of this analysis somehow show us that demonstrate that the availability of adaptation is needed, of course, but not sufficient to drive the consistent regular uptake of non-animal approaches. If we look also at the regulatory context, for instance, a very useful report that ECHA published on the use of alternatives to testing on animals for the REACH regulation, we can see that there is a positive trend and registrants are more and more using adaptation in their dossiers. Nevertheless, we should keep in mind that this doesn't mean automatically, doesn't translate into the fact that they are successfully used in regulatory decision-making, and also that for some endpoints, and in particular acute toxicity that we saw is one of the short-term goal of the roadmap, registrants still rely really heavily on animal testing, almost for 60% of the cases. What we also can conclude reading through this report is that the clear reduction in animal testing still occur mostly when non-animal methods are included in the standard information requirements, rather than relying only on Annex 11 adaptation. And this is missing in the report. It would be interesting to know more about it, how the different scenarios that I described before are used, so how many times adaptation related to technical impossibility is used, or when exposure data have been successfully used. All this information would allow us to better understand how to improve Annex 11 adaptation to make them really useful for taking regulatory decisions. So definitely there is room for improvement. If we think about REACH, the REACH revision has been announced, but then postponed, and it's still not clear if this will happen. But still there is progress that could be done via a more efficient implementation and also possibly via annex updates. So this is something that may likely happen, and where we think that the roadmap could really drive for a positive change. So now the question is, looking at this changing environment and also all these opportunities and challenges that we see, where we as AFSA collaboration can contribute positively to this change. And as a collaboration, we have different initiatives and different tools that we can use to support the phasing out and enforcing the last resort. One of these is the capacity building. So for instance, the AFSA masterclass that I just introduced at the beginning. But now I will present you more in detail one of the projects that instead focusing on decision support tools for regulatory uptake. And to do so, maybe just one step back. We're back to when we were discussing the last resort requirement and the REACH. And indeed, we have identified several enablers of enforcement of the last resort. So we have the specific articles in the legal text. We have Annex 11 adaptation. We have also procedures testing proposal, reference to very important regulation as the C440. And also the fact that in the last year, more and more guidance documents have been produced that describe how our data from the non-animal approaches can be used in the regulatory context. Nevertheless, there are still obstacles. So there is still a vague definition of last resort. There is dishomogeneous regulatory confidence for some of the approaches. So some regulator might be more confident or have more trust than others. What we think also is missing is a clear implementation framework for the last resort. so to fill some gaps for transparency and accountability. And last but not least, even though it's really important that these guidance documents are being produced, this also means that information can be scattered into different documents, and this can hamper the full use of such documents. All of this may trigger unnecessary animal testing requests and therefore inconsistency how non-animal approaches are used. So to fill this gap and to address this issue, the AFSA has initiated the Last Resort Decision Tree project. And the Last Resort Decision Tree wants to be a structured, science-based workflow that is designed to guide and document testing strategies to be to comply with the last resort requirement. So the main objective is to provide transparent and traceable decision logic, both for designing but also for evaluating testing strategies. So if we think about the two part of the discussion, assessor and registrants, we think the decision tree can help assessor to have a structured tool to evaluate whether all non-animal approaches have been considered at their full potential, have been and found insufficient before resorting to animal testing, but also provide registrant with an overview of what is possible to do today. So which are the suitable testing methods and their applicability for individual endpoint. The AFSA project has been discussed, it's been initiated, the framework, let's say, has been discussed in a first workshop that which outcome has been put together about the workshop report. And we invite you if you want to have a look. What another aspect of the decision tree that is important to mention is that it's really focusing on the short term. So if we think about the roadmap, if we think about the short-term action, the one where endpoints, for instance, where NAMs are and non-animal methods and NAMs are mature enough to there is an agreement that are mature enough to provide relevant information for regulatory purposes. So in particular, acute oral toxicity, but also skin sense, eye irritation, skin irritation, corrosion, and aquatic toxicity. This is because the AFSA, the last resort decision tree, aims really to be as compliant and close as possible at current regulatory practice. So that's why we have structured in modules that align with the international framework as the IATA, the integrated approaches to testing and assessment. And then each module has been populated by methods that have been recognized, of course, available, but regulatory suitable, both in vitro, computational, or animal-based in case of the last resort. These are clearly indicated in each module, and we also make reference to relevant guidelines and also refer to applicability limitation as much as possible. What we also have included in decision tree is then option for adaptation and waivers that are described in the current regulatory guidances. So this is how the skeleton of a decision tree looks like. So we have at the beginning the definition information requirement, and then different modules where based on different information sources an assessment can be done. So starting from the physical chemical properties, then in case of data gaps, a substance tailored testing strategy based on QSAR, in vitro methods of read-across. Then in module 3, also the possibility to evaluate whether available repeated in vivo data can be used and extrapolated to still fill the information needed. And then at the very end, module 4, there is assessment based on in vivo studies. So in this module, only if the other 3 modules have not been sufficient to bring to a conclusive hazard assessment, then one could ask the question if an in vivo studies make sense and can be used for the specific endpoints and for the specific chemistry, and if it brings then the information needed. So if we take as an example acute oral toxicity, that is our priority, the endpoint where we started the project, then the first step was to identify which are assays and methods that can help indeed to fill the module. So for instance, a corrosion in vitro test that can help to identify if physical chemical properties of the target chemical can allow for waiving, or for instance to bring indeed information in module 2. The cytotoxicity assay as the 3T3 neutral red uptake, and then other tools as the QSAR. So for instance, CATMOS, the Collaborative Acute Toxicity Modeling Suite, is also mentioned in our publication, because together with other promising tool, also recognized by a regulatory agency, that can be used for this endpoint. And then the second step is identified which are the relevant guidance documents that can support the use of these methods. And in particular, as the first decision tree is tailored for the EU, we first started with the ECHA available guidances on information requirements, also for difficult to test chemicals and OBCP. And we also, of course, included international relevant guidance as the waiving for bridging of ammonia acute toxicity test, and the very important QSAR assessment framework that really helps to use QSAR in a regulatory perspective. So we have put together all this information, and we have defined the detailed decision tree. This is the moment for acute toxicity. The manuscript is under revision, but we plan that as soon as it published to make a workshop that will guide through step by step, module by module, how the decision tree looks like and the different decision steps. But just to conclude on this project, what we think is relevant is to identify why goals to phase out animal testing. And we think we can do that by improving usability of regulatory guidance documents, so working together with regulatory agencies in this collaborative platform to consolidate scatter information into a coherent framework, support selection of science-driven testing strategy, and very importantly, to increase transparency and traceability of the last resort requirement enforcement. So this, we think that the project can be really particularly useful for the implementation of the roadmap, for instance, if we think about the short-term goals, but also in case indeed of the revising of REACH annexes, can also be used to provide a way how to provide an input based on scientific evidence and seeing really what animal methods can do for specific endpoints and provide confidence in these changes. So then we have other projects that will be presented by Martijn. So Martijn, please, I leave it to you.
Thank you, Georgia, and thank you for the excellent presentation. It's now my pleasure to guide you through the next couple of topics on thought leadership and regulatory accountability, and one of the projects of that. So if you can go to the next slide. Yes, so this is one of the topics, again, related to REACH and the REACH revision. REACH needed some revision after 20 years after the entry into force. It's still foreseen how it will be done. It's still not entirely clear, but we'll come to that later. But first, let's focus on this DIM testing project. The objective of this project was to find out if there were any tests done for the purpose of REACH that could be classified as difficult, impossible, or meaningless. And difficult meaning that the substance properties fall outside the normal applicability domain. Impossible also, again, on substance characteristics that render it virtually impossible to test the substance. And meaningless, yeah, that's a bit of a safety net for any test where the outcome of the study is considered to be at least questionable, but usually also not really putting any additional relevance to the safety risk assessment. So the DIM criteria that we set up were based on both physical chemical properties, things like solubility, volatility, and the reactivity, that invalidate certain animal test methods, or I would say the lack of biological or mechanistic relevance for specific substance classes. And then the project systematically reviewed REACH registration dossiers that were submitted after 2009, and we combined that with outcomes of the ECHA compliance check. And we identified a couple of dossiers with tests performed that we thought should have been waived because it was a meaningless test, or it was impossible to do, or the test was done in such a way that it was impossible to judge if you could say that the effect seen in the test was indeed could be led back to the substance itself, because all the adaptations you had to do to make sure that the test item was indeed sufficiently available in the test system. All could have been avoided through using non-animal approaches that were validated, or conducted in any other way, so that they would have produced more meaningful and relevant results. Because we've seen a lot of tests happening where we know already from some other endpoints that the test would have not have been relevant. I'm thinking from primarily on the chronic fish outcomes, where still an acute fish study was done. We could have seen from the chronic fish outcome that the acute fish study would not have added any meaningful results. So all in all, difficult is really having to make such test adaptations that it's really impossible to judge if you really test the effect of the substance or if you test the effect of all the adaptations of the test itself. Impossible is really making it impossible to test the substance because of the intrinsic properties of the substance. And meaningless is that we have other information, mainly from the biological or mechanistic field, that prove that any test in a certain endpoint would not add any relevant results. If we go to the next slide, then we get to the analysis that we made, and this is what we found. There's a lack of legal and regulatory certainty that also we accepted. So we know that some of the REACH registrants have tried to use NAMs, but in the various REACH consortia, it was sometimes difficult to get that message across because the other consortium members were not completely certain that the NAMs, the non-animal methods, would be accepted by ECHA. There's lack of clear scientific justification when additional data is requested, what methods are required and accepted for getting the additional data accepted. There seems to be a culture of checkbox compliance within regulatory assessments, also because of the fact that the legal framework is quite rigid and doesn't give regulators a lot of room to do anything else than that at the current point in time. There's also a reliance on arbitrary high dose testing and regulatory frameworks. NAMs are usually characterized by their limitations, whereas we see that in vivo studies are accepted as gold standard. And if you look at the human relevance, let alone the humane aspect of in vivo studies, they could be questioned there as well. And it's also unclear if the studies were conducted for REACH purposes or for other regulatory purposes. So the publication is currently under peer review, and we have focused on making constructive conclusions and recommendations. And the recommendations you can find here. And also we have made some preliminary recommendations in the position paper, and that position paper was developed because of the fact that this project was started before it became clear that the REACH revision or the certainty on the REACH revision became a bit less clear, and that the REACH legal text would not be changed that much. but that there's still possibilities there for the annexes. I'll walk you through the recommendations here. What we think is required is more exchange between the various stakeholders. Make it very collaborative. Make sure that there's a matter of trust where you can speak openly on various methods that can be used, non-animal methods, preferably over in vivo methods. Define scientific robust and adequacy across all the testing resources, also on the in vivo tests, so treat all tests equally in that way. Encourage substance-tailored testing strategies based on scientific justifications, and also improve the transparency and the traceability of the data and the regulatory purpose to make sure that we know why the test was done and if it can be used for regulatory purposes globally as well. Also, the incorporation of toxicokinetics and the role of toxicokinetics should be strengthened and aligned in testing strategies to get more meaningful exposure scenarios, because in the end, REACH is all about the safety risk assessment. It's not hazard driven, it's risk driven, and risk is a function of hazard and exposure. Policy recommendations are focusing on leveling the regulations to the latest state of science. Of course, the scientific methods should be validated, should be properly implemented, but that could improve the implementation and the use of Annex 11, and also support the legal and cultural transition, the paradigm shift to the next generation risk assessment, because in the end that's what we see. But constructively really enhance that and make sure that there's safe spaces to do that. The follow-up of this project will be on more on meaningless testing in general, because we see that both the difficult and impossible also fall into the meaningless bracket for in one way or another. But yeah, how can we support the roadmap goals here with this DIM project? I think our founders can be used to support policy changes, including supporting the roadmap, because it needs a paradigm change to phase out animal testing, to find more human relevant test methods and more humane test methods, making it contributing to the safety risk assessment. This would require some regulatory safe spaces, building trust between all stakeholders, regulators, and applicants alike. Also increasing the application of waivers, and that also requires a trust and a broader and more consistent use of QSAR methods. Because there's a lot of data in computational toxicology that can be used for filling the endpoint data gaps if there are gaps considered by ECHA. So there needs to be a more collaborative exchange between regulatory bodies and the registrants or applicants. And also provide science-based input for revising the REACH annexes, and especially then Annex 11 and the waivers to be used. These should be designed to facilitate routine regulatory use of scientifically robust non-animal approaches, rather than testing primarily as using in vivo methods, with an exceptionally being allowed to use computational or in vitro methods. So really moving from a more rigid prescriptive list of test methods to a more current state of science way of working with regulatory information requirement, focusing on the defined criteria linked to the regulatory risk management, ensuring that the protection of human health and the environment is warranted, but using not only hazard, but also including things like toxicokinetics, and leading to a more a better use of the exposure data as well. So it's really the objective to make a paradigm change here, moving to non-animal testing. And that's an important contribution I think we can make from this project. If you move to the next slide, I will give you an update on the workshops and expert engagement that this collaboration is also supporting. And in the coming month, there will be a high-level AFSA workshop on the integrated approaches to testing and assessment, IATA, really focusing on how NAM-supported IATA can support safe and sustainable chemical globally. So it's really to explore if that NAM-supported IATA can become the foundation for safer and more sustainable use of chemicals or global chemical regulation, to really support that, to bring experts together from regulatory bodies, science, industries, NGOs, and policy communities. Would help to have that meaningful discussion on that, to see where we can build that trust, and see where we still need to work, what we still further need to develop, because we are quite sure that there will be some scientific gaps to be identified, regulatory barriers that need to be overcome, and those social and trust-related challenges, because it's not just European. This is much broader, and we try to make it as global as possible, because this is not just a European story. This has a global impact. And with that, we also hope to identify the opportunities for the transformation, and really have that system change, that paradigm change. The report of this workshop will be published in due course. Maybe go to the next slide. This workshop's outcomes should also, of course, support the European Commission's goals to phase out animal testing, to support those roadmap goals, by informing the long-term actions and addressing the long-term actions of the roadmap that really support that paradigm shift, and provide also an international perspective on the gaps, the barriers and challenges, and also opportunities. Because it's not just a European field. We need to look at this from a holistic point of view, because we see that other geographies have different speeds of implementing non-animal testing, have different intentions with that. You have a different strategy for that as well. So let's make sure that we align that as much as possible, to avoid that the various stakeholders have to do a lot of double work here. Because the more we are aligned globally, the better it is for animal welfare. So if you go to the next slide, that's really to say that EFSA helps to bridge the gap. So that's a big aim, to bridge those gaps. We know that the policy direction is there with the roadmap, but it's still a bit unclear what the objective is. The objective is clear, but there's more to be clarified on the pathway of the implementation. How the what is clear, but the how is something that we need to address. There's sufficient opportunities, but these opportunities need to be implemented. We have mechanisms in REACH that can be used more effectively. We have annexes that can be updated and therefore improve that implementation to deliver the progress, and further implement that to lead to the objectives of the roadmap. And also the dialogue platforms, the safe spaces, can really support that mutual understanding and trust and increase the confidence that indeed, also with non-animal methods, we can support the safety risk assessment and the safety in general for human health and the environment. So we intend to accelerate that implementation by providing practical tools, supporting regulators and all stakeholders in the field, and help to translate the policy ambitions into regulatory practice. Go to the next slide. Yes, on behalf of Georgia as well here, a big thank you to the AFSA Global Science Committee and Executive Committee, and also, of course, on all the project team members and the Last Resort Decision Tree project and the DIM testing project. We could not have done this without you. It was very insightful to get all the various ideas and the very deep discussions, sometimes a bit philosophical, but that was for a good cause and for that it fit the purpose to make sure that we really got to the gist of it, and that we made the publications where they are today. And yes, also to the Global Science Committee and Executive Committee, of course, for guiding us through these projects to asking the right questions and to make sure that we move into the right direction, and that we're fully supported and backed by the broad and deep scientific knowledge that there is, and by the executive committee people that is really supporting from a more strategic policy point of view. So yeah, with that, we thank you very much for attending this webinar, and we have listed here all the QR codes of the AFSA publications to have that all in one overview for you. And now I think we can start with the Q&A session. So I'm handing back to Nicolas.
Thank you very much, Martijn. And first of all, a big thank you for your presentation, both Georgia and Martijn. I think they were quite insightful. I'm just looking at the Q&A section. So there are, let's say, some questions. So I don't know what is best, because I saw at least 3 of them. Are you happy just, let's say, to switch on your camera and mic and ask the question, or do you prefer me just to go through them?
I think they're not, there is not a function. I should do it manually. So maybe, Nicolas, if you could read them.
Okay, so I will start with the highest. So there is one question from Kum Yadikes, and I'm sorry for mispronouncing it. In the context of REACH, is there a non-animal alternative method to address the endpoint for short-term repeated dose toxicity? And here we talk about 28 days repeated dose study. So who wants to answer this quite challenging first question?
Yeah, but I can try to give a start at least, because I mean this is it's a good question. There is these are some of the action that maybe, if we refer to the roadmap, are indeed maybe in the medium term or long term. But so there is not one NAM, so no one animal alternative approach that would do that. We are aware of this. It will be. Oh. Wait. All right. There will be the need of using a battery or a IATA framework approach. And actually, this is something that's been explored in different platforms. So at the OECD level, but also in scientific consortia in EU. So there is already some progress and case studies that have been presented. When we'll be ready for REACH, this is something that will be important to monitor and see, and hopefully the roadmap will help us to keep the track of when it's ready and can be mature enough to be included.
Thank you very much, Georgia. The following question is, a little bit different. So as from Erica Armstrong, as a risk assessor, I find there are many instances of animal models being used in academic settings in which the risk benefit is not clear. Example, non-guideline studies, specific endpoint only with a large amount of waste or loss of potential data. Is there anything AFSA does to help research institutes understand how to make the most use of their animal data?
Yeah, I mean, so we were talking about academia, so not for regulatory purposes. We have, I mean, not in AFSA, but there is the Biomed 21 collaboration that is also led by Humane World for Animals that is directly tackling this. So this is an extremely important area. We know that in terms of animal numbers is one of the most relevant one. So it's a great point. Definitely, animal should not be used in this way. Is a bit linking back to the meaningless, right? Every meaningless, both in a regulatory scenario, but also for biomedical. This should really stop as soon as possible. So for this, is not directly AFSA involved, but it's more other organizations as a Biomed 21.
So
I don't know if Jay or...
Yeah.
Sorry.
Jay, go ahead, please.
Oh yeah, I didn't really have much to add there. AFSA really focuses on making the change in the regulatory testing sphere. We obviously know that there's crossover. There's academic institutions that are maybe developing new methods and relying on previous animal testing type data. But yeah, as Georgia said, Humane World for Animals is working within the Biomed 21 collaboration to address this area of academic use of animals and in the broader biomedical research area altogether. And it kind of helps that we have, Humane World for Animals can be involved in both, so we can benefit from each other's insights in that way.
And if I may
oh yeah, go ahead, Martin.
If I may add, I think it makes sense for both risk assessors and also researchers in academia using animal models. Take the EFSA masterclasses. Look at them, see what you can get from that, and if your research can benefit from that. Because it might make more sense than just performing yet another animal test. And sometimes you might need to perform the test, but then at least you have some more knowledge on what's possible outside the animal testing.
My last comment on this was maybe it's a call for connection. So and see, let's say how to exploit, let's say, the information that is existing. Another question was, let's say, shared by Merel Riskes-Heitinger. What do you think of the TSAR database? Can this help to move forward? Who wants to reply?
Yeah, I can start. So it's indeed important. There are more databases. So I don't know if this was directly relevant for the question before. So the TSAR is more for regulatory purposes because indeed gives an overview of the regulatory status. So if it is validated, as there is a test guideline, so can provide this kind of information. This is again based on the link on knowledge and improve the accessibility of information. So yes, the TSAR database can help. There are other databases that are actually at the moment available, similar also in the biomed space. And this is really, there is a lot of ongoing, there is a lot of ready. It's about bridging the gap between who is not aware or is not familiar or still doesn't have enough information with the information that is there.
Jay?
Jay, you're muted.
I'm muted. I just want to add to that. Yeah, the ZAR database and these other databases are really helpful and great to show us what is available. I think one thing that I would say is the decision trees that Georgia was presenting do a really great job in terms of structuring what's available into something usable, because it's great to know what is available, but it's really more important to know how and when to use these different methods. And I think that the decision trees really go a long way to helping people understand, their own chemical context and the options that are available in that regard.
Thank you very much. Do we have time for a final question? Okay, so this time it's going to be me asking you guys, and I would like to know what are the key priorities for the next phase of project, and how can interested participants be engaged with or support this effort? So who wants to answer?
I don't know if Martijn, you want to start this, or shall I go?
For the priorities for the next project related to the meaningless testing, of course, to see where to start. We had a first workshop to see what a priority should be for the next for the follow-up of that project. But yeah, people can still contact us, of course, if they want to contribute to these projects, because there's the more knowledge we get, the more insights you share with us, the better it is. So that's one element. There are also a lot of other follow-ups scheduled. There's a lot of ideas also coming up from the Global Science Committee. So that it's almost too much to mention it all now. But Georgia, maybe you can tell a bit more on the follow-up on the decision tree project.
Yeah, thank you, Martijn. Yeah, there is a lot to do. So we at the moment, we have, as you know, as I mentioned, other endpoints that we need to finalize in terms of the first decision tree and publish the related manuscript. The next steps for all of them is also discussion at the OECD level. So we are planning case studies to show how the decision tree will work. And this is more on the, say, on the global level, but then on the regional specific one in EU, we are in contact, for instance, with ECHA or via the roadmap platform to see how indeed how the decision tree can really help for some of the action. So this is something that we would like to do together with other platforms that are working on the similar issues. And on the globe and on the other regions, other local teams have also started to see how decision tree could be implemented in other regions. So this will also be very interesting to see how similar they are, or if there are some specific things that should be changed for making this usable.
Thank you very much. And thank you very much for all of your questions. Maybe time to hand over to Jay.
Yeah, thank you. Thank you so much, Nicola. And thank you also for helping chair this webinar. We really appreciate it. And we also appreciate L'Oréal for being a great AFSA partner. So thank you. I just want to thank everybody for attending. Also, just in terms of the next steps bit, our AFSA masterclass, we are now taking steps to translate it into more languages. It's only available in English, but we want to start by translating it into Chinese and then hopefully more languages beyond that. On the screen, we have the QR code for our first webinar. Please go ahead and check that out to get a little bit more detail and context around what's happening on the global level. And keep your eyes peeled, please, for the rest of the webinars in this series. We're going to hopefully tackle South Korea, Brazil, and China this year, and look to tackle many more countries in the coming years. So thank you so much. Thank you, Georgia. And Martijn, your insights and your work are exceptional, as always. And thank you again, Nicola. And thanks to all of you. We'll see you next time.
Thank you very much.
Thank you very much. Bye-bye.
Bye-bye.